In honor of Women's Health Week this week, we sat down with Dr. Chi-Chen Hong, an epidemiologist at Roswell Park Comprehensive Cancer Center. In this interview, she discusses and sheds light on research that she was recently a part of, which studied the impact of discrimination on inflammatory biomarkers among Black breast cancer survivors. Thank you so much for joining us today, Dr. Hong. We're really excited to talk to you. Would you like to begin with an introduction of yourself and what you do?
So I'm Chi-Chen Hong, and I'm at Roswell Park Comprehensive Cancer Center. And I'm an epidemiologist by training in breast cancer research primarily. And most of my studies are in breast cancer survivorship. So looking at sort of which factors, particularly like lifestyle factors, that are associated with outcomes. So we're interested in obesity, inflammation, cancer immunity, and how that affects sort of outcomes primarily in Black women because they experience more disparities. So they had worse prognosis than compared to white women.
Would you like to tell us more about the presentation that you are a part of?
Sure. So this was work done in the Women's Circle of Health follow-up study. So this is a cohort of about 2,000 Black breast cancer survivors. And this was co-led by Dr. Lisa Bandera, who's over at Rutgers Cancer Institute of New Jersey, and Dr. Kata Demasi in SUNY Downstate, and myself, and I'm at Roswell Park. So this study builds off sort of an earlier study that was initially led by Dr. Christine Ambrosoni. It was her case control study, where she was looking at sort of women with cancer, women without cancer, trying to figure out factors that lead to more severe disease. So in this particular analysis that was presented at AACR annual meeting a couple of weeks ago, this was a poster, and it was led by Dr. Nur Zainamer at Rutgers. She was focused on whether self-reported experiences of discrimination were associated with inflammatory biomarkers among Black breast cancer survivors. And so in the data analysis, it involved 156 women, and these women provided blood samples 2 to 3 years after their diagnosis. And they also completed a questionnaire, a validated questionnaire that asked questions about their experience with discrimination in 9 different settings. So this is like your experiences at work, school, getting medical care, for instance, or when applying for a job. And then in our cohort, we also used multiplex Luminex assays. And so we measured a number of biomarkers that are associated with systemic inflammation. So in this particular analysis, we only used 4 of them, and they focused on like high sensitivity C-reactive protein, IL-6, TNF-alpha, and IL-1 beta. And so all of these are inflammatory markers, and they potentially can reflect the body's response to stress or other diseases, infections, so forth. And so in the analysis, it was pretty small, so it was a pilot study. We found that 74 participants actually did report some experience with discrimination, but in our analysis, we didn't really actually observe a statistically significant association between discrimination and the biomarker levels. And this is after adjusting for a number of potential factors that could be confounding or influencing that relationship. But what we did find was this sort of non-significant elevation in TNF-alpha and IL-1 beta among those individuals that reported experiencing discrimination. So I think overall, even though our findings weren't that definitive just because of our small sample size, it does suggest a potential link between discrimination, mediated stress, and then inflammation in Black breast cancer survivors. And so I think it just highlights the need for larger studies to try to better understand how some of these social stressors might influence biology and breast cancer outcomes amongst Black women.
Could you tell us a bit more about what inflammatory related biomarkers are and how they're connected to potential discrimination of Black breast cancer patients and survivors?
So in our particular study, we were focusing on these biomarkers, or so circulating in the blood, systemic biomarkers that indicate whether there's inflammation, and then a little bit about the severity of the inflammation. And so we had focused on CRP, which is, well defined in the literature, IL-16F alpha and IL-1. And these are just involved in the body's immune response. And commonly they're elevated when there's like an infection, if there's an injury, or in this particular case, we're looking at it to see if it's elevated under chronic stress. So when people are stressed, those levels tend to be a little bit higher, and especially if they're obese or something like that. So just to give you some background, inflammation, it's a natural protective response. Like it goes off and it'll kill bacteria and viruses. So, that's a good thing, but it could also be higher because of long-term stress. And so that's the issue. And so for Black individuals, including breast cancer survivors, the experiences of racial discrimination, we're hypothesizing that it could serve as a chronic stressor in these women. And that will potentially keep the body in this sort of prolonged state of fight or flight. So then going back to sort of inflammation, when you have that happening, you can get chronic inflammation. And that's an issue because that's been linked to poor outcomes amongst cancer patients in general. So that leads to like increased risk of recurrence, increase of risk of chronic diseases like cardiovascular disease, which is like the second most common cause of death amongst breast cancer patients. So that's a real issue because it has sort of these long-term implications. So by studying these biomarkers, we're just hoping to understand whether stress from discrimination has a biological effect and whether it might be contributing to some of the health disparities we see in breast cancer survivorship amongst Black women.
What kind of biological impacts do you suspect discrimination has on Black breast cancer survivors?
So we're thinking that discrimination as a form of chronic stress could affect the body's biology, especially by increasing inflammation and putting pressure on the systems that help us respond to stress. So these systems include like the hormonal system and the nervous system responses, and which release chemicals like cortisol and adrenaline to help the body cope with these stressful events. So normally, having these stress hormones are really helpful in short bursts, like when you're like being chased by a bear or something. But if the stress is constant, like if you might experience with discrimination, the body might just remain in this really prolonged state of alertness. So over time, this can disrupt normal immune function. You can lead to chronic inflammation and increased immune suppression. So those are all areas that we're interested in. And if that happens, it could just potentially make the body more vulnerable to illness in general. And in cancer, it just might worsen prognosis. And that's why we're interested in some of these questions. And so ultimately, these kind of sort of physiological wear and tear, which is sort of behind the concept of allostatic load that a lot of people are interested in, it could contribute to worse outcomes in cancer survivorship and have a potential impact on cancer progression and recurrence.
And how do you think clinicians could do better in preventing and tackling the issue of discrimination experienced by Black patients and survivors?
I think clinicians, it's really important to listen to patients' experiences, like treat everyone with respect and being aware of that discrimination can potentially affect health. I think it'd be great if healthcare providers, all of them, can receive some kind of training that promotes respect for patients from a lot of diverse backgrounds, and that will help them improve communication and just help build trust with their patients. And it's also important for providers, I think, to make sure that Black patients and other minoritized populations get really the same access to cancer care, follow-up care, support services, and resources compared to everybody else, right? And so then addressing discrimination in healthcare means that both treating people fairly and pushing for changes in the system to promote equity could potentially have, a long-term positive impact for these people.
Do you have any plans to continue the study? If so, maybe in other minoritized populations?
I think we do have a plan to continue this work. So I think because this study was so small, we do need to there is this need for larger studies and to have more statistical power to better understand how discrimination can affect biology and cancer outcomes. And so we're kind of interested in exploring these questions in other historically marginalized groups as well, like Hispanic women. We're trying to get a cohort together up, doctors. Elisa Bandera, Bonnie Chin, and we just put a grant in for that. So we're hoping to look at that as well. And I think it's important to look at different communities just because a lot of these communities face really unique stressors in their lives. And so that may be contributing to the health disparities experienced by each of these populations. And I think it's important to sort of look at all of them and look at these different populations that have poor outcomes in general. Actually, Bonnie Chin over at Rutgers, she's the one that's been leading a lot of the work we have within the Women's Circle Health follow-up study to look at social determinants of health, right? So we know now, there's a lot of factors that at the individual level that can affect your risk of cancer and how well you do in your prognosis. But then in addition, we know now that a lot of that environmental factors also play a role. And so there's a lot of interest right now in trying to sort of integrate both the individual level risk factors with the sort of broader risk factors, whether in the environment or social policy or so forth, that also contribute to how well you do.
Since Women's Health Week is coming up, I just wanted to ask you if there's any messages you would like to relay to those listening in relation to your study or in general about health.
So I think from our study, it did provide some hints that there's this possible link between discrimination and inflammation among Black breast cancer survivors. And so in our study, it wasn't significant, but there has been a lot of other studies that have kind of looked at this question a little bit. And what they have shown is that discrimination can have biological effects. And so, for instance, there was this recent study done by Bird and Allen. It was published in 2023, and they found that lifetime and job-related discrimination were associated with greater levels of inflammation. And this was true in particular for Black women. So that was very interesting because that does have potential consequences for survivorship and prognosis. So I think the main message is that the stress potentially caused by discrimination may have these biological effects. They could help, influence recovery and long-term health. And I think just a lot more research is needed in this area to really understand these connections. Personally, I would just encourage all women to prioritize their health and speak up about their needs and really seek support and know that their experiences matter in both research and care because of the effects on biology that you do see.
Thank you so much, Dr. Hong, for speaking with us today in your research and your colleagues' research. We're definitely excited to hear more about it in the future. And thank you for your time today.
Sir, much for having me.